Thanks for listening to Live Forever Young Radio. 99% of ex-NFL players studied have been diagnosed with the degenerative brain condition known as CTE, or chronic traumatic encephalopathy. In today's show, Rollie and Bob take a look at everything that we know so far about CTE. They dive deep into the history of the condition and identify who it affects the most, what symptoms to look out for, and the damage that concussions can cause. Learn about some alternative treatments that athletes have used to help overcome the effects of CTE, and some great resources to help support individuals and families of those who may have CTE. So sit back, listen, and get ready to live forever young.
Hello everyone, and welcome to Live Forever Young Radio. I'm Bob, and I'm here with Rollie. Rollie dressed in red today.
Yep, I got my football stuff on because we're going to be talking about a really, really important topic that I think a lot of people are starting to learn a lot more about. It's called chronic traumatic encephalopathy.
Right, or CTE for
Correct.
short.
Right.
And it tends to be something that happens to football players because it's also known as the concussion disease.
Right.
Football players are in a very heavy contact sport and tend to get concussions more often than other people.
Yes.
And are more susceptible to CTE.
Right. Yeah, when we were looking up some information on CTE, they actually first started recognizing it in the 1920s, like around 1928. They started recognizing it mostly in boxers, obviously, because they're taking the blows to the head, and they would use the term punch drunk back then. So you're too many punches, you're punch drunk. Well, actually, it was the CTE, the chronic traumatic encephalopathy, that they were actually starting to realize was happening. And then many years later, they started realizing, like Bob said, it was in all contact sports, ones that where you come into really high impact with somebody, and a lot of the time, especially with the way the safety things were, really affects people negatively. When we looked at some statistics, we actually found that the study they did at Boston University, 99% of the brains from NFL football players had CTE. So, pretty crazy.
Yeah, and there was a movie about this
Right.
that we've seen called Concussion.
Yep, Will Smith.
Will Smith, and this was a case where a doctor, Dr. Omalu, right, who's from Nigeria, I believe.
Yes, he's a Nigerian pathologist.
So he was doing research and had the opportunity to do an autopsy on a football player named Mike Webster, who was the center for the Pittsburgh Steelers and had had numerous concussions and exhibited lots of symptoms that we'll get into later that are now characteristics of people with CTE, and he decided to do this autopsy to see what his brain looked like, and they found out on autopsy that yes, he did have CTE.
Yeah, and so Dr. Omalu, when he found this out, he actually went to the NFL and told them, he actually did a study on two different brains from former NFL players, Mike and another one, and when he went to them both times, the NFL tried to kind of brush it under the rug and, hey, no, those studies aren't accurate. But by the time he went the second time, there was a lot more information coming out in the press about CTE. And by the time that it happened, an article had just been released. And that article went into a lot of detail about the procedures that Dr. Omalu actually was performing. And right around that time, there had to be a House Judicial Committee hearing with Mr. Roger Goodell. And at that time, there were a lot of hearings about how to make it safer, safety concerns, and things that the NFL was going to be doing in the future to actually make it better for players.
Yeah. And later on, it's in 2015, there was a lawsuit brought by about 5,000 NFL players, ex-NFL players, against the NFL, and they were ultimately awarded, $765 million?
Yeah.
Thereabouts?
Yep.
And as compensation for their injuries.
Yeah.
So then what are the symptoms
Right.
that people exhibit who have CTE. And it's important to note, Rollie, that sometimes when people exhibit symptoms as if they had CTE, when they did the autopsy later, it turns out they didn't actually have CTE. So it's good to remember that there might be other causes. So when we talk later about some of the treatment options, that they might work even better if someone's exhibiting symptoms but doesn't actually have CTE.
Gotcha.
So we'll get to that. But some of the symptoms that people will exhibit is confusion, being disoriented, maybe getting lost, starting to have memory loss, starting to have headaches or blurry vision. People get real sensitive to light and to loud sounds.
Irritable.
Yeah, they get definitely irritable, and they tend to have sleep issues, which leads to lots more complications. And the worst scenarios, they can become very erratic and aggressive and unpredictable, and also suicidal.
Yeah.
So we've had situations here in Tampa Bay with ex-pro football players with Tampa, without mentioning any names, that were very beloved community figures, very popular, very kind, supportive men that had done lots for the community that ended up dying from CTE.
Yeah, all of a sudden their demeanor changes, everything changes about them, and then they end up not being a real good outcome.
Yeah. And so these are the things where if you know someone who's had a lot of concussions and they start to exhibit this, these are, the things that might indicate that this is what's going on.
Right. So, right. And we call it chronic traumatic encephalopathy, which is chronic, something that recurs over and over again, traumatic, injuries. So chronic injuries, and encephalopathy actually means a shrinking of the brain, right?
Yep.
So we're talking about CT, but what's actually going on, right? What's actually happening in the brain?
Yep.
That's what we want to know.
Yeah. So in your brain, you have these proteins that are called tau proteins, TAU, and they're very valuable proteins. They help with the scaffolding of the inside of neurons, right? But if they begin to not function properly, because proteins are always folding, right? So proteins are very elaborate,
very intricate structures,
and unfold, and as they do, things change, right? The polarities change, and then they can combine with other proteins and participate in metabolic pathways, right? But when they stop folding correctly, this creates all kinds of problems. And in the case of CTE, if you end up with tau proteins that are not functioning properly, they get deposited into your brain and all over your brain, but particularly in the little troughs in the folds. So if you look at a brain, it looks like it's wrinkled.
Right.
And you have these raised parts and troughs, and the tau proteins will get
Like
down in those troughs, like a little trench, right? And that's kind of the signature of CTE.
And when they do that, from what we were reading, these proteins entangle themselves with each other.
Yeah, they create tangles that end up interrupting cell signals
and
all
pathways
throughout the brain, and you end up with these symptoms.
Well, yeah,
that we just talked about.
If you've got tangled up proteins in the brain, it's making all the signals go different places they shouldn't. So of course you're going to feel disoriented and confused and not remember anything because you've got all these tangles. It's like Christmas time. You pull out the Christmas lights. It's like here's a little knot. It's like this giant thing you got to untangle. The lights will never work. Yeah.
The same concept, and it's the how it works, what the chemistry of these tau proteins and how it's affecting the brain is pretty well known now. And so now we have to look at, well, what can people do to try to change things, right? So we know that inside the brain, there are numerous things going on, including electrical, chemical, and also waveforms,
Mm-hmm.
and we know that they all interplay together.
Right.
So we know that if you have a particular waveform in a part of the brain, it can either facilitate or inhibit a chemical process.
Okay.
Right? And we know that there's ways to manipulate those waveforms,
Right.
including technology called neurobiofeedback.
Mm-hmm.
Now, neurobiofeedback's been around for decades, and we know of a story of a person who had numerous concussions and one severe concussion that put him out of commission in the National Football League, right? Boomer Esiason.
Yep.
Now, we know we can use his name because he was public about it at the time. And Boomer Esiason now is fully recovered and is a broadcaster.
Yeah, he's
doing
actually
very well.
Doing really well.
But at the time, what he did for treatment, because he wasn't able to play anymore and he wanted to get back to playing, is he went to get neurobiofeedback treatments. Okay? Now, neurobiofeedback is a process where the patient will wear this leather helmet that has these detection devices in it that are detecting brain waves. And there is a normal range over here, and then here's the patient that's had the concussion, and the doctor can see exactly which parts of the brain waves have been knocked out of whack.
Gotcha. So they have a good reference of healthy brain and messed up
Right.
brain.
And so then, using a computer screen and a software program where they program in specific parameters, they can actually change the brain waves in the patient's head in specific regions of the brain.
Whoa.
And the way they do it is they will use either a technique where you have to practice concentrating on, in this case, they used an airplane with Boomer Esiason. So he would look at the computer screen, and this little airplane would start to fly across the screen, and then it would dive and crash. Now, his job was to focus on imagining it flying all the way across the screen without crashing.
Okay.
And while he was doing that, in order to make that occur, he had to have that specific area of his brain that was being treated vibrating in a specific brainwave.
Gotcha.
And so as he focused on that plane flying across, it started to train his brain to go back to the proper brainwave. Okay. Nowadays, they also use it with humor. So if you're trying to take a section of the brain that's vibrating mostly in beta, but it's supposed to be in theta, occasionally it'll hit theta, and the scientists are eavesdropping with this helmet. And when it hits theta, they quickly turn on a video clip of the patient's choice, which is humorous. So you can watch a comedy show from TV, whatever it
Clip
is.
from a movie, whatever.
And what happens is the humor is teaching that part of the brain that it's now associated with theta. Humor is a preferential state of mind, and so it starts to reprogram that part of the brain to vibrate in theta instead of beta.
Cool.
Okay? That's an example. All right? And so as these brain waves get reset, okay, the difficulties someone's been having with focus, concentration, sleep,
Memory, all that.
those go away, and
Gotcha.
they can function normally again.
That's
right?
cool.
In the case of Boomer Esiason, not only was he able to go back and play football again, but when he went back to play, he actually set a record, an NFL record for the most passing yards in a game.
Yeah.
So he came back stronger than ever. And he was treated at a place in upstate New York called the Alexandria Institute of Integrative Medicine.
Okay.
And they were specialists in neurobiofeedback there.
Well, yeah, it obviously worked.
Worked really well. Also, other famous athletes whose names we can't use were also treated at that facility, but in their respective sport were equally as famous as Boomer,
Sure.
but also had the same concussion issue, not able to play, went for treatment, able to get back and play again.
And I'm glad you're talking about the treatments, because one of the things that, when we were talking about how the tau proteins are formed and then they fold, there's been a lot of research done recently that's showing that the concussions themselves are sometimes what cause these tau proteins to not be created correctly, to fold.
Right, exactly. And a lot of it's related to inflammation.
Correct.
So we
and that's
know
where I was
that
going with next.
concussions can create inflammation.
Exactly.
Right? We know
Read
from
my mind.
another study that was done on many different people that where they measured inflammation, and the reason they did is back during those studies in 2009, the original studies, they gave a list of follow-up research suggestions to see if there were other conditions that were contributing to the CTE in addition to the concussion, and they recommended investigating inflammation.
Yes.
So this one group of scientists did that, and their conclusion at the end of the study was, in every case where the people had low inflammation, they never developed CTE. So we know from the podcast we did on inflammation
In your health.
that you can do that.
Yes, absolutely. We talk about plenty of things, plenty of ways to lower it. One of the things that we are blessed to have is our Gladiator and Heirloom barley, because it actually has a really powerful antioxidant in it that helps to scavenge free radicals and lower inflammation. It's one of the best things you could use.
Absolutely. You can lower inflammation in your brain and all throughout your body using that compound, superoxide dismutase, plus trimethylglycine, right, and glutathione, which are in the Boomer Boost
Right, in
product.
our other product.
Combine them together, you can reduce your inflammation by a factor of 10.
Yes.
And could be the exact thing that somebody might need, who you might know that's had concussions, to prevent them from manifesting with CTE.
Right, because we talk about it on every show, you guys. I mean, inflammation is the root of plenty of chronic diseases, and it might not be the root of this one, but it's certainly a very large contributing factor from what we can tell so far. So to get rid of that would be really helpful. And, you know, when you have a lot of inflammation, you're not comfortable. So when you're not comfortable, you have a hard time sleeping. And so one of the things that we're trying to get people that are suffering with CTE is help with sleep, because there's studies that show if you don't sleep, your brain shrinks even more.
Right.
You know, so that's the last thing they need to do is not
Right.
sleep.
Right. And so even if they have CTE, people can take advantage of some of the information that's in our podcast on sleep. For example, if someone's sensitive to light, all right, well, that's a problem, because then you're going to avoid the light during the daytime, and it's going to be difficult for your body, mind to know that it's nighttime when the sun goes down.
Right.
And so there's a way that you can get light that will not be offensive to a person who's light sensitive. They have these lights that you can put on the wall that give out red lights and non-visible light. So near infrared light and infrared light is emitted by this device. Your body will absorb the photons. It'll realize that it's daytime, and you'll be in a waking state. And then at nighttime, you want to make sure everything's dark. An hour before bedtime, you want to make sure that you wind down all light that's blue, right? All light, period, really, and get into bed in a completely dark room.
Right.
Now, also, people can tend to have, their mind might be racing.
Yep.
People with CTE, happens a lot. Their mind is racing, and so you need the techniques for relaxation, which you can learn to do lymph drainage for yourself.
Right.
You can learn to relax your tongue.
Yes.
You can
that's
learn to do the emotional freedom technique.
All those we have videos on our YouTube channel, Boomers Forever Young. So take a look. Under playlists, you'll find the emotional freedom technique and the ultimate mind calming exercise. Very helpful to sleep.
Yep.
And I just wanted to mention, we're talking about CTE as if we're able to diagnose it. We're actually kind of talking like that. Well, we can't actually do that. You can't actually diagnose it, unfortunately, until the person passes away and you cut open their brain. But what we're talking about is people who might exhibit symptoms like that.
Right.
And then if you, again, want to make sure these things don't happen, with some of these creative treatments, you can try to not let it manifest, keep your reduction of, or your inflammation down with inflammation reduction, look into things like neurobiofeedback. And there's also a really good resource that we found, concussionfoundation.org.
Yep.
And that's one we wanted to tell you guys about, because if you know anybody who might have these symptoms and they might be playing a sport that would cause it, you can check out concussionfoundation.org for some really good information.
Yep. Has information there for caregivers too. You know, there's a book written about caregivers for people with Alzheimer's disease. It's called The 36-Hour Day. And similarly, people with CTE, because of their symptoms, it can cause a lot of strain on the family, the caregivers. And so people can read that book. Also, there's lots of information for supportive caregivers on concussionfoundation.org as well.
Absolutely, absolutely. Well, you know, as you could see, I don't know if you guys noticed, but we have been sponsoring a lot of MMA fighters lately. We've had a couple. We've had Jesse Arnett, and we also have Kyle Driscoll and Curtis DeMarcy. And these are some great MMA fighters that we're actually really proud to sponsor. We actually really excited to have them use our Gladiator barley because of the protective effects it can have on reducing inflammation and helping with their recovery time. So if you guys haven't read our blogs about it, go to boomerboost.com, check out our Live Forever Young Radio blogs, and you'll be able to read all about Jesse and all about Kyle. Actually, Kyle has a match coming up tonight for the Lightweight Cage Warriors Championship in just a few hours. I don't have my watch on, but I'm keeping track.
He's over in London fighting for the World Championship.
Getting ready tonight. So hopefully we'll have another champion on our side, and Gladiator Barley keeping them healthy and strong.
As we do with Jesse, who won the championship in the 135-pound weight.
That's right, Jesse Arnett, UAE Warriors featherweight champion, won that on July 2nd. Yeah. We actually have a blog up about that, so go read all that and check it out and get caught up. Give us a like and a subscribe on our YouTube channel. We can't wait to see you.
Yeah. And thanks, everybody, for watching and listening to Live Forever Young Radio. Thank you, Rollie. See you on the next show.
Thanks for listening to Live Forever Young Radio. Check us out at liveforeveryoungradio.com.